COVID-19 restrictions loosened, mask mandates dropped, and summer travel surged. It became the season of what's called revenge travel. But there are reports and concerns that the next COVID wave could be on a collision course with holiday travel and holiday gatherings. Yet, many Americans have resumed activities without masks and act like the pandemic is a thing of the past.
We've gotten so used to it, right? We're so used to people always being in the hospital with COVID. We're so used to hearing people are dying from complications of COVID that this is just part of it.
Dr. Jason Newland is a pediatric infectious diseases physician and professor, and he's vice chair of community health and strategic planning for the Department of Pediatrics in the Division of Infectious Diseases at Washington University School of Medicine in St. Louis. Newland believes a lot of people have let their guard down without realizing some alarming facts. In the United States alone,
there's over 350 people dying a day of COVID-19. As of October 19, 2022, now that's way better than it was at 400. But when you're having 12,000 people die in a month, that's a lot of people dying in a month from a virus.
That's why Newland says the updated bivalent COVID-19 boosters against the newer COVID-19 strains are so important.
The new COVID boosters are comprised of the Omicron variants that have been circulating most recently, this BA.4, BA.5, as well as the original vaccine. So it's a bivalent vaccine. These are important because this vaccine is more targeted to what the COVID-19 is currently.
Newland says COVID-19 vaccines are effective against symptomatic infections.
And the data is very clear, especially those 65 and older. If you had your primary series but weren't boosted, you are 2.5 times more likely to be hospitalized. If you are completely unvaccinated, you are 10 times more likely to be hospitalized. You need to think about, number one, well, definitely be boosted. Number two, get all your family members boosted and vaccinated, because right now you're going to give yourself another layer of protection.
The booster is recommended for younger people and children.
Over 1,700 kids have died of COVID-19 in our country. Now, that doesn't sound like a lot when we've had over 1 million. But let's put it in context. Influenza kills 150 to 200 kids every year, right? Now, the pandemic isn't even 3 years old, and we're well above that.
Newland believes the vaccines and the updated booster help reduce transmission from one person to the next.
The data shows vaccinated people less likely to shed as well. So you just reduce the risk of transmitting to others if you're vaccinated. If your whole family's vaccinated and they're at the height of their vaccines, their chances of getting symptomatically sick and spread it become less. So you have to say that those families that have been vaccinated have been less likely to end up in the hospital and also less likely to give it to other people.
Which he says has not been made clear enough to the public.
That's how we've done vaccines, right? We vaccinate all family members for pertussis. We do that because that prevents the baby from getting it. That's why I think that terminology gets confusing, but we need to show that better.
For this reason, Newland feels children and teenagers should get the bivalent booster, not only for themselves, but also to benefit older adults.
Especially have grandparents, you want to see them during the holidays. If I have a family that's vaccinated, they are less likely to get it. We know that, right? We know that even if it's 60% effective against symptomatic disease, well, if they're not getting it, they can't pass it.